Hi there, welcome to Empowered PT with Dr. E. Today we're going to be discussing DVTs, deep vein thromboses, or blood clots. So, who's at risk for a DVT? Well, anyone who's had a surgery, anybody that has been on bed rest for a prolonged period, or even has been on a really long airplane flight. Just lack of mobility, surgery, age is also a predisposing factor. As we get older, there is a higher prevalence of DVTs. And so what does it really mean? What is a blood clot or DVT? A DVT is a injury to a portion of the deep vein. And what we worry about here is that that portion of injury can break off into a clot, and that clot can travel up to the lungs. And that can cause a pulmonary embolism, which can lead to death. So it is really important that we understand the signs and symptoms of a DVT so that we can recognize it and get treatment immediately. So what are signs and symptoms? So typically what you may experience with the DVT is a deep throbbing or aching that doesn't seem to change with activity. It's just constantly there. And usually there will be swelling that accompanies it, and sometimes they're hard to detect after surgery because you might already have swelling present. But the distinction really is this deep, relentless throbbing pain. You may also have a redness or darkening of the skin around the area, and most commonly, patients will experience this in their calf, but it can also occur in the thigh, in the pelvis, and in the upper extremity. So the big symptoms that you would be looking out for are a deep throb and aching. Sometimes tenderness to the touch can also be present. A change or discoloration in the skin tone around the area where the pain is. So if you experience any of those symptoms, you need to contact your doctor immediately or get into the emergency room so that they can do an ultrasound, a Doppler study, and detect if in fact you do have a blood clot. Treatment of this is fairly straightforward. They will typically give you a blood thinner and just keep a close eye on it. Have you wear compression stockings, make sure you're moving. But it's essential that you catch it in those early stages before it breaks off and potentially travels to the lung. If it does travel to the lung, then your symptoms would be shortness of breath, more pain and difficulty breathing on the inhalation, an increased heart rate and pulse. So that becomes a life-threatening emergency. So if it has in fact traveled to the lung and you're experiencing shortness of breath, you need to dial 911 and get immediate help. Really, time is of the essence there. So it becomes a life-threatening matter at that point. So the goal is to understand the signs and symptoms so that you can recognize them and contact your doctor and get the help that you need immediately before it has an opportunity to become a pulmonary embolism and travel to the lung. So I hope that you found this video helpful. I hope you understand a little bit better what a DVT is, some signs and symptoms, and what you need to do if you experience any of those symptoms yourself. Thanks so much for joining me. Take care, and I look forward to seeing you on the next video. Bye-bye.